which is the gendered aspect of HIV. You're mentioning just how different key populations, depending on the geographical location. Jamaica, it's a different key population. Sub-Saharan Africa, it's another key population. Can you talk a little bit about this need for these multifaceted approaches to these complex and multifaceted problems? How one location needs its own approach, not one size fits all when it comes to these issues. How important is it to acknowledge these intersecting issues such as gender-based violence that you've just mentioned, lack of economic sustainabilities, and why it is so important to look at the approaches and the responses as based on the community needs? Why is that so important? Why are these assessments so important?
Look, we have long agreed in the response that, and many people repeat it, but I'm not sure they always mean it. All of what we do needs to be evidence-driven and data-driven. But then look how many countries are actually producing data, especially on key populations. I was just reviewing a board paper for our next board next month on incarcerated populations and people in closed settings. There's one of the things we note is that there is a dearth of data, right? So if data and evidence informs your programs, then you need to create that data. And I want to just make sure that I'm not misunderstood. Even in Africa, even in what we used to call generalized epidemics, even in a Botswana, in a Namibia, in a South Africa, it matters that in every country you have key populations, and you will have gay men, and you will have transgender people, and you will have drug users and sex workers. So you will have to make sure that those populations are always part of what your vision is and where you are putting your programs, but maybe it's not where all your work goes, right? But you will be surprised how many countries are still finding it hard to produce accurate data for those populations. And that is a political statement, right? So if I don't have data, then maybe these people don't exist. And we all know in every community, these people exist, whether you like that or not. So one encouragement always that we have with governments is to have a conversation about how do we get to data sets that actually reflect what your problem is and where your problem is, and that it might shift. I give you another example. Philippines, they've been very successful in managing part of their problem. They had a good response for many years. They also had a problem in their drug user communities. Maybe that was more difficult for them to respond to it, to say it very carefully. But now they have a real shift in their response. If you look at their data, they have an increase in new infections by over 400%. 400%. So that's a real problem, right? And a very committed Ministry of Health who really wants to tackle this. And they are good in actually figuring out where their problem is. They have a totally changed epidemic. They have young gay men who get infected very young, find it very hard in a quite conservative environment to test, because they needed parental consent. They have changed that now. You can test without parental consent. And then when you test it, you still need a parental consent to get on ARVs, which means you still have to go and talk to your parents and say, look, I'm a gay man, I'm sexually active, and now I have a sexually transmitted infection. And they're thinking about and they're working on how they can get these young men onto treatment without having to have that conversation. Because they're seeing that not only is the infection rates going up, but their death rates are going up. And people are dying very young because they haven't actually been able to get onto treatment at the right time. So that's the importance of data, right? Because that data shows you this is where you have to focus. And then it talks to you about your enabling environment. You now need to find a policy environment that ensures that the people most at risk and most affected will get access to the right services at the right time, so that you stop the public health crisis of a rising infection rate, but also obviously do the best for your population to be on treatment. And so that speaks to the 10 million or almost 10 million that are not on treatment, right? So I think it explains to us that and that we need to be vigilant, that we need to keep on producing these data sets, and that we need to be vigilant as people in public health, but also in broader health and development fora in each country, to keep on looking at what is it actually that is driving our epidemic.